Having some trouble. Okay. All right. Welcome to the February the 2nd, 2026 Carroll County Board of Health meeting. This meeting was originally scheduled for January 26th. However, due to weather, we had to postpone it for a week. We are having technical difficulties, so we do not have video. However, we do have audio. And we will go ahead and just, we will take roll call. Keith Thackeray.
Here.
Chad Springer.
Here.
Julie Beckner.
Here.
Ben Anderson.
Here.
Myself, Sarah Rich. Not present, Denise Strasser and Jen Fife. Unless they're online, no. Okay. All right. So we have the minutes for the last meeting. Has everyone had a chance to look over those? We give a few minutes to look over those minutes.
Second.
All those in favor, say aye.
Aye.
Motion passed. The minutes from the October 27, 2025 board meeting are approved. Next, introduction for our new health department employees.
Ashlyn Osprey is currently out of medical leave. Joe Soon. Hope Hill is our new public health nurse.
Hello.
And,
Nice to meet everybody.
Welcome, Hope. We're happy to have you here, and we're happy to also have Ashlyn here, so thank you very much. We appreciate it. And we'll start with our division reports. We will have Randy Myers with the food sanitarian.
Well, the report's there.
Anything that stood out to you?
Nope, not the select board. Keeping it pretty smooth. Next board might be different. New health code. Started January 1st.
Okay.
We'll deal with that next board.
Do you feel like you've been able to get enough education for that? Like, if they put out a lot of things from the state?
I have, but it's getting into the people that.
Sure. Sure.
Any questions?
Oh, no questions. Thank you, Randy. The environmental health specialist report for Kevin. He is out
he's out
on medical leave. Okay.
He didn't have
Okay. Okay. And then are we ready to go ahead with the public health nurse report with Hope?
I can. So it looks like, I came at the end of the fourth quarter, so, but it looks like for the children's vaccination rates, it looks like we did have, it says, is it 47 for the quarter? Why do I think that could be a little bit lower? Probably because they have primary is my guess, so that's probably a good thing. And then the adults, it looks like fourth quarter shots were only at 13, but again, my guess is like you can get them at CVS and other places, and hopefully they have primary here, so I think that's why that's only at that number. And that I know of right now, we don't have any of the physical smoking, I don't think we have any of that. And then communicable diseases, it looks like there was 6, and we have some new, it looks like the acute hepatitis C, and then the cryptosporidiosis, and did I say it wrong? Salmonella, and then it looks like Shigella, but I'm almost sure I cleared all of those up that were on so there's nothing else new. I think that's it, right? That's all I have.
Thank you. Any questions? We'll go ahead and add to the minutes Jen Fife is here. Next, we have the Vital Records Administrator, Megan Smith.
Okay. So all the numbers are pretty much there. I don't really have anything new to mention. Kind of brought in a little less towards the end of the year there, but with the holidays and everything, everybody's kind of enjoying their families and everything, so things get a little bit slower around that time. But that's all there. Anybody have any questions about any of the numbers or anything like that?
I don't think we have any questions. Thank you, Megan. Do we have a county, I know she's not here. Do we have a county liaison report or?
Before she left, she got all of our MOUs updated and all of our policies done, and they were all prepared until the end of March, so March 1st, and she'll be back before we have to do anything else more.
Great, okay. And now the health officer's report.
Okay, we sent out the 2025 end of year budget for you guys to review. It's not printed, but it was in an email. I don't know if any of you had a chance to look at it, if you had any questions about it. Copy of it.
I do have a copy of it. I didn't have any questions.
Okay. So the big thing for the HFI fund, the 1161 fund, we had several initiatives that we had discussed throughout last year that we had not spent all of the funds for. So the table that Megan made that kind of summarizes those, you can look at those. So we spent about half of what we allocated for the packet plays from last year, so we still have a little over $1,000 left on that. So if we wanted to vote to continue any of those, we can, and then appropriate the funds from the state. We would apply to the state to use those HFI funds again for this year. So if any of these initiatives are things that we would like to continue, we can vote to go back and capture those funds. So if you look at, you don't have the full report, but the end of the year total for the HFI funds last year balance was $205,000 roughly. So if we want to vote on pack and plays and heart screenings from those funds, we can't. We had already voted.
So,
If you would like me to propose the individual initiatives, I can.
yeah, so what would you like? So you want to,
So like for pack and plays, if we want to continue that, we have $1,000 left over. So if we want to just vote to continue that, we can.
okay,
If you want to do it individually, that's certainly fine.
what do you recommend?
I think individual's fine. Maybe, yeah. So the pack and plays, we spent $987.80 last year. We had allocated total $2,000. If we want to vote to continue the balance for this year, we can apply for that to the state.
I'll make a motion that we continue to fund the pack and plays. And that would be up to the $2,000? Okay.
The balance.
The balance, whatever, yeah.
I second that.
All those in favor?
Aye.
Okay, motion passed. We'll continue to fund the pack and plays.
The Zach Go cardiac screening, I think, was a great success. We screened 39 kids. We have tried to get the invoice from Teresa repeatedly. The state has called, and we have had no response back. So she never billed us for it. I would like to at least carry it forward so that we can pay her if she does bill us, or we put it towards this year's screenings too.
What should the invoice have been? Do you remember?
That's a great question.
Was it wouldn't be over the 6,000?
No, it would not. It would not. But along in that line of discussion that I don't know how well they could handle doing larger screenings if we wanted to increase the number total. Especially going to Carroll and Delphi, I think it'd be great to do separate screenings, and to do that, I think we'd have to use for, and they charge a lot for it. Exactly what the foundation does for the screenings. I think they charge $80 instead of $25. So if we wanted to budget for, say, 100 kids to be screened, we need to vote for about $8,000 or $10,000 total.
Remind me, how did we do it this year? Did we just go to one school and do it?
Yeah, we did held it at the Delphi Middle School.
That's what I thought.
And both schools came to it.
Yeah.
But if we wanted to try and do one event at each school, I think we could. I just don't know that we can get the Zach McGo Foundation to do both. Maybe one of them, but probably not both. So if that would be, I think ideally to be safe, if we wanted to budget for the M4 service, we could carry over the $5,400 some dollars plus another $10,000 total. And once we get it all figured out in the logistics, maybe we do one event this spring, and then if we do get a bill, we'll still have enough funds to pay her, and then we can vote at another meeting to fund another event in the fall. So I was kind of proposing $10,000 for the parking screen.
I think, anyone want a motion to accept? I'll
I'll make a motion.
make a motion. I'll second it.
$10,000 towards Zach Megan.
All those in favor say aye to the
Aye.
second. Okay. Motion passed. We'll go ahead and fund $10,000 towards the Zach McGo Foundation. Is that right? Cardiac screening, just cardiac screening, however you. Yep.
Swim lessons, we had allocated $10,000 last year, we spent $4,000. We had a balance left over, some of which we spent on A1Cs, the last board meeting, and the $2,500 that we were gonna use for gift cards. And there was logistical issues with getting gift cards because we can't purchase order the gift cards, we have to use the credit card, so we never got around to ordering the gift cards. If we want to continue with the swim lesson idea of giving a $25 gift card for anyone that brings a certificate that their child completed a early swim lesson program somewhere, we can vote to continue that $2,500. Or if you don't want to, that's fine. We tried to discuss with the why coming into the county to try and host swim lessons, and it was going to be $10,000 or $15,000. So I think offering the incentive to promote or encourage people to get swim lessons may be a much cheaper option for us than trying to actually host swim lessons.
And we think we'll be able to get gift.
We can, we just needed more time.
We need, okay.
I'll make a motion.
Second.
All those in favor say aye. Aye. Motion passed to fund the swim lesson initiative.
Okay. And then for our wellness events that we've been doing, we've expanded those from last quarter. We started doing cholesterol screening as well. I think it's all gone very well. The Purdue Pharmacy Fellowship has been phenomenal. They've really developed a good relationship with the Opera House, and they're looking at ways to expand and continue screening. Now that we have full staff, it's a lot easier to manage those events as well. We had spent a good chunk of it. We have plenty of A1Cs at this point. So test kit wise, mostly I think we just need more cholesterol strips. So I don't know that we need to ask for that much this meeting, but maybe $3,000 for continued wellness events or funds, just so we can keep up with some of the screening supplies.
I'll make a motion to go ahead and fund the wellness supplies.
Second?
All those in favor say aye.
Aye.
Motion passed. To fund the cholesterol, A1C, whatever, the wellness kits.
The next one on here is the Purdue medicine, we had voted $4,600 in last year. This is a continued class that is, they're billing us with each month that they're doing it. So, they've only billed us $1,500 so far. We need to vote on the balance of what we had allocated last time of $3,095.57. Which it sounds like has gone very well. We've been doing the screenings there as well. So we have, I think, 25 people.
Would anyone like to make a motion to continue to fund the Food as Medicine program through Purdue Extension?
Motion.
Okay.
Second.
Okay. All those in favor say aye. Aye. All right, motion passed.
Facts are done. Nathan Harmon School Skipper's done. Car seat, the Delta Police Department car seats and gun safety, I, at this point, would recommend holding any further funds, even though we had allocated funds from them, because they have failed to give us any data that we requested. We've asked the number of attendees to gun safety classes repeatedly, and they just won't respond. So, until we get the data that we need to continue reporting that to the state, I don't recommend we authorize any further funds. We can certainly do it later.
Do we need to do anything with that?
No.
Okay.
They still need to get us data for stuff they've already done. So we just,
Having car seat data and having gun safety. For our own car seats here, if we want to fund maybe $1,500 for the internal health department car seats, that we will have them available. I think that would be reasonable, just so that we have some.
I'll make a motion to put $1,500 towards health department car seats.
I'll second that.
All those in favor to put $1,500 for health department car seats?
Right.
Aye.
Aye.
Okay, motion passed.
And lastly, the packing place, we already voted that one.
Mhm. Yep.
Okay, so that's all of the HFI funds. On, Sarah, you can see more on the balance reports there for 1168 and 1206. We have the current fund balance. So this is 1168. So the current fund balance we have for 1168 is $60,708. These are the old funds that HFI replaced. So these are the old grants that HFI was supposed to replace. 1206, that's 1206. So 1206 is another older fund, and it has $54,664. So the 1206 fund cannot fund salaries, and 1168 can. So last Board of Health meeting, we talked about coming up with the offering STDs for the first time in the health department, what kind of costs it would have. A lot of the supplies, medicines, treatments are covered by the state. We just have to provide the needles. It's the one thing they won't supply. But to roll this out for the first time with our Hope is doing great, phenomenal, but still learning all of the new steps. I do think it would be beneficial to still have some assistance from the part-time nurse, which we don't currently have any funds for. So if we roll this out, it would help us with the STD initiative, as well as kind of smooth over our new hiring process here. So that what I proposed from the 1168 is there's already a part-time nurse line item on that grant fund, so we would just need to appropriate from the state funds for the part-time nurse, as well as supplies for the EMR, some personal health supplies for the copier maintenance, because we're going to be using the copier more, and apparently we have a maintenance contract and stuff. We don't currently have funding, so I would estimate total time of the part-time nurse would be about $23,000 with the Social Security coverage. So 23,000 for the part-time nurse, 5,000 for EMR and supplies, $2,000 for personnel supplies, and $1,000 for property maintenance. A total of $31,000 in the 1168 fund. And the current balance on that fund is $60,780. There is, we don't have to spend the grant funds, they don't go away, but the state kind of asks us repeatedly why we still have these old grant funds, so I'm not saying we need to burn them all, or use them all up, but I think this would be a good use of using some of it up.
Any discussion, any questions? Anyone want to make a motion to go ahead and accept your proposal to use the funds for the part-time nurse and for the EMR and copier, postage, environmental supplies, freezer?
Motion.
Second.
All those in favor say aye.
Aye.
Motion passed.
And the next one I had for the 1206 fund, that's the one that has the $54,000 balance. Our fridge sensors apparently have to be replaced this year. So we actually balanced or budgeted for that previously on that fund, but we didn't this year, because we have to appropriate for it. So we have $1,000 for the supplies, $3,000 for educational supplies, $1,000 for postage, and $3,000 for environmental supplies, which is a total of $8,000 from the $54,000 total. Again, no salaries can be funded out of the 1206, just strictly supplies.
You need, go ahead and make a motion for that. I'll go ahead and make a motion for that.
Second.
All those in favor say aye.
Aye.
Aye. Motion passed.
Next on my list, I think there was the borough sewage update. We had a great turnout, maybe 50, 60 people at the town hall. Lots of strong opinions shared, and I think it was very informative. This may be a little too technical and detailed than we need to do, but we had really great speakers that offered a lot of information and insight to what problem in boroughs is, but it's not just in boroughs, it's all the small towns in the whole country essentially. But it did go well. We had a few people that wanted water testing, so we can use some of these funds to finish that. And we'll hopefully have further discussions with them and learn from our feedback there to carry to the next town. There are no current prices we're aware of in boroughs for the sewage system, but we have a magic 8 ball. At 5, 10, 15 years from now, they're probably going to need something. And it takes at least 4 to 5 years to even get to something. So I do think it was successful. We had a great turnout, so hopefully we can carry it forward to the next town. Lastly, the commissioners requested that the health department be responsible for maintaining the AEDs in the courthouse. I said that we would bring it to you guys for a vote, and then we would need to request funds from the county to pay for those, so.
What do you mean by maintaining? Just like.
So like the batteries and the pads being replaced. They're gonna expire in August of this year.
Who maintains them in other county facilities?
Whoever's in charge of the facility.
So they just want just the courthouse?
Correct, just the courthouse.
Who was doing it before?
We did. Yeah, I think we did.
Well, then it would make sense.
It's just never official. Like, I think somebody asked us to, and somehow did we get a grant for them?
Yeah, for the initial, but I think then we had funds in it. I trying to remember, I think that we had some funds left over that we
Used it for.
used up for that, yeah.
It's, they're getting old. and
So,
they're gonna be
so who
replaced.
pays for the replacing them, replacing batteries, replacing the whole
County will, I think it should come out of the 1159 county fund.
Okay.
Yeah.
Would be my
Speaking from
recommendation
school
for you.
experience, they are very expensive, yes. and
But I think there's
We've got a lot.
3 total, 2? Okay. So I would suggest that they, I don't think you have to vote on this, the commissioners and council vote on how much they would allocate for us, but if you agree that we should do it, then we'll take that to the commissioners.
So if it's us, then who does that really fall upon? Does it fall upon these guys to make sure that they're getting maintenance and batteries are being replaced, or you?
Not the board of health, but, you know, the health department is responsible for making sure we keep up with the,
Monthly checks and isn't there there's a little something there with the state knowing where AEDs are going through EMA, right? There is something like, I know in the hospitals, like we've been,
the Department of Homeland Security.
Yes.
You have to register every AED through Department of Homeland Security.
yes,
So I've given that task to Ashlyn when she gets back
Okay.
to track down every AED in the county and make sure they're.
okay.
you
So
know,
that
list
doesn't,
of them and they're registered with the Department of Homeland
Okay.
Security. We had talked about this a couple meetings ago, that no one is tracking AEDs in the county. And there's supposed to be a registry of them that's kept up with the Department of Homeland Security, so. Again, I don't want to, we do not want to be responsible for the county AEDs, but the courthouse. 2 AEDs in the courthouse,
how do you feel about that?
as long as they fund it, I think it's
As
fine.
long as they fund it, it's okay. Okay. You feel like you have the staff to, I mean, if they're in, okay.
I don't think that custodian staff will be responsible for it, so I don't think it's unreasonable.
As long as they're
As long as
funding it.
Yes, they need to fund it, and as long as it's beneficial. That was my complaint in the past, is that it was just kind of a handshake agreement, but it needs to be in paper.
How often does stuff need replaced on them?
2 to 3 years.
And the whole AED may need replaced, or do we?
Eventually.
Okay.
At this time, I think they need to replace the entire AED. I don't know that they make the batteries anymore.
Yeah, that's what we ran into Carroll, so we got about 11 we had to replace, just because of that reasons.
Does anyone want to go ahead and make a motion that the health department be responsible for the monthly checks and making sure that everything is up to date, not expired?
I'll make a motion.
For the courthouse
For the courthouse
Yes.
only? That's
Second.
good. All those in favor say aye.
Aye.
Aye. Motion passed.
I don't think I have anything else. Do you guys have any questions for me?
Further questions? Go ahead and set our next meeting, April, 6 PM. And what date? Do we want to try for like April the 20th? Just putting that out there.
Works for me.
Okay. Okay. All right. Our next board meeting will be April the 20th, 2026, at 6 PM here in the Commissioner's room, second floor. And I think our meeting, anyone have a motion to adjourn our meeting tonight?
Motion.
I'll second the motion.
Second.
Okay. All those in favor say aye. Aye. Motion passed. We are adjourning.